Crow's feet, what a horrible term, but it is what it is, and that's what we tend to refer to these lines that appear at the corners of the eyes, which a lot of people don't like. That said, some people say, hey, it gives me character, it shows my personality, and I like them, and that's all well and well. But if you don't, what can you do about them? Well, there's a few simple things you need to know about crow's feet. First of all, where are you with them? Because if they only appear when you're smiling or when you're squinting, then that's a really nice stage to be, because you've probably not formed those deep static lines, the ones that are there even if you're at rest, even if you stretch your skin, you can still see them. Those really need to be treated like scars, and you're going to need something either like fine hyaluronic acid filler being put in with the right technique and the right product, of course, or actually something like laser resurfacing or microneedling with growth factors is really good to help actually resurface that skin, and that's really what you're trying to do. I like that because the improvements you get from those treatments are generally quite long term. If you are not at that stage and you still haven't formed those deep static lines and they're more on movement, then of course anti-wrinkle injections are the go-to option if you're willing to have in-clinic treatments, because they're basically like a potent anti-aging cream, an anti-wrinkle cream. That's what they are. You're not going to move that muscle as much. If you're not folding that skin as much, you're not reinforcing that line as much, and so you're delaying the appearance of those static lines, which you have yet to hopefully see. If you've got very early static lines, then they can sometimes disappear for a few weeks after anti-wrinkle injections, but don't see that as your measure of success, because within maybe 4 to 6 weeks, as some of the movement starts returning, you are going to see those lines reappear. And it's more about what's happening passively when you're not thinking about it. A mistake people often make with anti-wrinkle injections is as they get older and their skin gets looser, they often think that it's going to sort them out. And if they don't see enough improvement, they want more and more put in. And that's really bad news, because it isn't the muscle that's the issue there. It's just the loose skin. I always give the analogy of a 17 or 18-year-old who won't have had, hopefully, anti-wrinkle injections. But if you look at them with their nice tight skin, they can smile and squint all you want and you won't really see much going on here. Why is that? When their muscles actually working fully, that's because their skin's nice and tight. So if you don't work on the skin quality, if you don't work on keeping your collagen reserves up in your skin, which is depleting from your early 20s, then even if you're happy with the anti-wrinkle injection results early on, after 10, 15 years, you're going to start being disappointed. So you've got to keep on top of that as well. So anti-wrinkle injections for that early to mid stage, resurfacing, or perhaps dermal filler injection for later on microneedling, laser resurfacing. Plex is another great treatment, fantastic treatment in fact, which is gas plasma. All of those are really, really good for those deep static lines, and even in one treatment you can get fantastic improvements. And the one important thing we haven't mentioned, home skincare. So prevention. What do we mean? Well, obviously UV radiation is a key factor. So you've really got to make sure you're getting your sunscreen, make sure there's some zinc oxide in there, and ensure you get it around the eye area. A lot of people ignore this area. Make sure the product is suitable for that area, and certainly Selderma Ultralight Mineral, which I recommend, is definitely suitable for that area and actually quite soothing, hydrating, and anti-inflammatory as well. That product alone actually provides you with the antioxidants and the anti-inflammatory agents. So if you just use that, you'll be on to a great start. But of course there are other ingredients. Growth factors are the most potent corrective regenerative formula that you can imagine, and GF5 is my go-to, or Youth Restore from Selderma. Both have a very, very high concentration of growth factors in there, and of course retinoids. But the issue with retinoids around the eyes and irritation means that the only one I'm ever going to use is retinase, which is this one. And this has a retinoid in it that has been shown in studies to have efficacy of maybe 20 to 30 times that have 1% retinol, but doesn't have the irritant side effects. In fact, we've got 2 independent studies on this formula, and not one single subject out of 40 participants had any irritant side effects, and it was only run for 28 days, and that's usually when people are going to get the side effects if they are. So I love this because you can still use it around the eyes and you can get really powerful improvements in that area. And again, as I say, we've got the studies to back that up. So home skincare for prevention and for active treatment of this area is really important. Of course, if you're looking for a dedicated eye serum, then iLift is fantastic. It's got a collagen stimulator. It's also got an anti-glycation agent, which means it helps prevent the damage that sugar binding to collagen creates as well in the skin. So iLift is a fantastic product. So you've got home skincare, you've got anti-wrinkle injections, you've got resurfacing treatments, you've got dermal filler, hyaluronic acid injections. All of these can help improve. Of course, there are treatments that I haven't specifically touched on, other in-clinic treatments, RF microneedling, nitrogen plasma, so many other options. But the important thing is if you are thinking of in-clinic treatments, you need to go to an appropriate clinic that offers a variety of options so they can give you an unbiased, ethical consultation on your options, even if they're not available there, and then you can make an informed choice based on budget and downtime and where you are in your state of line and wrinkle formation. So there you have it. That's kind of a nutshell on crow's feet lines. Do subscribe if you haven't already, and give me any comments down below. Thank you.